There are different types of inhaler devices available to patients. The different types of inhalers need different types of breath to work well. These are Metadose inhalers, sometimes known as aerosol spray inhalers or puffers. Metadose inhalers contain propellant gases which propel the medication out of the inhaler. They need you to take a slow and steady breath in as you press down on the canister. If you are using this type of inhaler, it is recommended that you use a spacer device with it. Spacers can help to get the medication to where it is needed in the airways. These are different dry powder inhalers. They come in different shapes and sizes. Dry powder inhalers do not contain any gas. They rely on you to take a fast and deep breath to disperse tiny particles of the medication through to your airways. They do not require a spacer. Most people can use a dry powder inhaler, but some people, such as children under 12, some elderly people, and those with severe asthma may not be able to take the fast and deep breath required. Another difference between inhalers is whether they have a dose counter. All dry powder inhalers come with a dose counter. Some Metadose inhalers don't have a dose counter. This can make it difficult for people to know when their medicine has run out, as the inhaler may still produce a puff of gas. So, if you find it difficult tracking how often you are using your inhaler or knowing how much medicine is left in your inhaler, then you can ask for one with a dose counter. Another consideration for some people is the environmental impact of the different types of inhaler devices. Metadose inhalers contain propellant gas, which are powerful greenhouse gases. These are used to propel the medication out of the inhaler. Dry powder inhalers do not contain propellant gas and so have a much lower carbon footprint. If you are interested in changing your inhaler device, speak to your healthcare team first to find out if this is suitable for you. Whichever inhaler you use, the most important thing you can do for your asthma and for the planet is for your asthma to be well controlled with an inhaler device you feel comfortable to use well. When your inhaler is empty, remember to return it to the pharmacy. If inhalers are disposed alongside household waste, then they may end up in landfills. If Metadose inhalers end up in landfills, the powerful greenhouse gases may be released into the atmosphere, contributing to climate change. Your pharmacy will ensure that your inhalers are safely disposed or recycled. All patients with asthma have an annual asthma review, so make sure you remember to attend these appointments to check your asthma control, your inhaler technique, and discuss your management plan with a healthcare professional. If you have any questions about your asthma, then you should talk to your healthcare team or refer to the advice on the Asthma UK website.